Good evening. As hospitalizations grow at a rapid pace in Ontario, the health minister is taking heat today after declaring the province isn't in a crisis. The comments came in response to a question about rising ICU numbers that are forcing some hospitals in lockdown regions to cancel surgeries. In Ontario, hospitalizations have increased by almost 80% in just 4 weeks, from 367 patients on November 4th to 656 today. Despite the concerns raised by medical professionals, Ontario's Health Minister Christine Elliott says things could be worse.
Ontario is not in crisis right now. You want to speak about who is in crisis? Have you taken a look at Alberta where they're doubling up patients in intensive care units? We're not doing that in Ontario.
The comment sparking a firestorm of criticism from the public and opposition leaders who say the minister is comparing Ontario to the worst instead of striving to be the best.
I think it's really unfortunate that the minister and frankly the government chooses which provinces it's going to compare itself to. Just saying that, oh, we're better off than one province because they're doing worse simply is just, I think, very insensitive.
Because we compare ourselves to some other jurisdiction doesn't mean that we're doing a good job. Those words give no comfort to people who are worried.
When asked about the comment during the province's daily update, the health minister doubled down.
Well, there's no question that many Ontario hospitals are under stress right now, but to say that they're in crisis is not the case. Alberta is in crisis when you have to have double cohorts in a single intensive care room.
She says her government has enhanced capacity, creating more than 3,100 new hospital beds to handle the influx of patients. But it is no comfort to those who are already seeing their surgeries cancelled as the number of people in ICU approaches 200. Meanwhile, more questions today about COVID-19 vaccines and which groups should be prioritized once they do arrive in Ontario.
That's going to be up to the task force and General Hillier and the Minister of Health to put that list together.
The government acknowledging the most vulnerable populations like long-term care home residents and frontline healthcare workers should be at the front of the line. The Premier was absent from yesterday's press conference due to a medical appointment. Today he revealed it was because he had zapped his back out. Now, another big topic today was a letter from some of Ontario's largest retailers urging the Premier to reopen non-essential businesses at 25% capacity. Our Shauna